This is Chelsea Marks for VETT 222, task number 4, which is a manual white blood cell count differential. I'm going to go over our supplies that we need here. First, we're going to show you, we have our microscope here. We have some paper to write down our numbers on. Here are platelet counts and our each type of each cell there. We have a pen. We have our cell counter, which is labeled and counts each types of cells, helps me count each type of cell. So basophil, eosinophil, segment, neutrophils, lymphocytes, monocytes, and the total count. And that will go ahead and ding when I get to 100 cells. We have a calculator here, and we have our oil immersion oil, and we have our slide. So I have my nice slide here with a good feathered edge there, little rainbow effect going on. And we're going to go ahead and get that set up on our microscope stage now. Okay, so first thing I'm going to do is go ahead and put it butt end to the left. Okay, we're going to start on the low power first, so we have it on our 4X right now, so we're just going to use that to get focused in. Okay, so I have that in focus. We're going to go down to our 10X and adjust the light and the condenser. Okay, get down to our 10X there. And adjusting the fine adjustment right now. Okay, so the 10X is in place. We're going to just scan the film to make sure it's stained appropriately. Take these glasses off for a second. So it does look like it's stained pretty well. We're going to make our way over here to the feathered edge. So I'm happy with the stain. So we're just also looking for any large objects right now. Not finding any. Okay, so I'm happy with that stain and the quality of the smear. Okay, so now that I'm in the monolayer, we're going to go ahead and start counting our white blood cell, observing the white blood cells and getting a white blood cell estimate per 5 fields. Okay, so that is 5 fields, and I got 21. So to get that total white blood cell count, we're going to do 21 times 1,000 divided by 4, and we get 5,250 as our total white blood cell count. Okay, so now that we have that done, we're going to go ahead and everything looks pretty good. I don't see any abnormal cells right now under the 40X. So we're going to go ahead and rotate the turret one more time, and we're going to add a drop of immersion oil. Just a little bit goes a long way. Okay, and we're going to rotate that oil immersion lens onto our slide here. Perfect. Okay, and I'm going to navigate back again to our feathered edge and adjust our light and our condenser. Okay, so in this field, we're going to go ahead and identify all the separate types of our white blood cells. So we're going to look for the neutrophils, lymphocytes, monocytes, basophils, and eosinophils. And we're going to use our cell counter as we identify them, and it's going to count for us. And when we get to 100, it's going to ding. So I'm going to start counting. I'll show you how I start counting, and then we may pause the video so I can keep counting. It does take a while, and then we'll come back to it when I'm close to 100. I'm going to show you here how we start to count. Okay, so we have a neutrophil there. Same thing. So we're just identifying each type. So that is a lymphocyte. You may have to adjust the fine focus as you go. Scanning in the battlement pattern. As you can see, you can scan pretty quickly. I'm also, I'm not counting them right now, but I'm kind of checking out the platelets as I'm going to be sure that they look adequate in each high power field. We're going to get a platelet count in a moment. There's a lymphocyte. Platelets are looking adequate. I'm not seeing any nucleated red blood cells, which would mean that we would have to do a corrected white blood cell count to account for those. I'm not seeing any yet. These are mostly segmented neutrophils and lymphocytes. I haven't actually seen any eosinophils or basophils yet, or any monocytes. Oop, there's our first monocyte. Lymphocyte. Lymphocyte. So the neutrophils are your most abundant white blood cell that you're going to find, with your lymphocytes being your second most abundant. Eosinophils you're going to see with a parasitic infection, and basophils you're going to see if you're having an allergic response. Haven't seen many basophils in my lifetime. If I see them, I usually take a picture of them with my camera because you don't see very many here. There's an eosinophil. I don't even know which one it is. I don't see very many of those in here either. Lymphocyte. There's another eosinophil. Okay, so I'm just going to keep doing my count, moving in our battlement pattern and making sure that I hit a button every time I see a certain type of white blood cell. And I will come back when we get a little closer to our 100. Oh, there is a monocyte. 2 of them. And when we get closer to 100, we will start filming one more time and go over our platelet count. Okay. Okay, so I'm back here and we're just now finishing. I've reached 99 cells, and I'm going to go ahead and count the last one so you can hear the counter ding. So we have last one being an eosinophil. That's interesting. So that was the ding. So we have our numbers here counted on our cell counter that I'm going to go ahead and record over here. So we have 67 neutrophils counted, 24 lymphocytes, 4 monocytes, 0 basophils, and 5 eosinophils. So that is out of the 100. And we're going to go ahead and work on our platelet count now. So in 10 views, we're going to go ahead and count the amount of platelets that we see. And we're going to go ahead and record that on the sheet. So we'll be right back when I'm finished counting 10 fields of the platelets. Okay, so I've just finished my platelet count, and we have our 10 fields. So I'm going to go ahead and add those together. So we have 11 plus 8 plus 10 plus 13 plus 15 plus 16 plus 21 plus 10 plus 23 plus 22 plus 13. So we're getting 162. We're going to go ahead and divide that by 10, our average of 16.2 per high power field, and then multiply that by 15,000 to get our estimated platelet count, which is 243,000 platelets. Okay, do that one more time to make sure we did that right. Just adding all those numbers back up one more time, so 162 divided by your high power fields of 10, so that's 16.2 on average, times 15,000. Gives you 243,000 platelets total, so we're going to go ahead and call those adequate. Adequate is 7 to 10 per high power field. I do want to note that some of the fields were a little low, and that is because I have a good picture here of it, of the platelet clumping. So right here, there's a good amount of platelets clumped all together, and they kind of are stuck together as one unit. So that's one reason you're going to see a low platelet count there. If you experience a low platelet count, could be due to clumping. So we have our platelet count finished, and we have our, I'm going to go ahead and start with our, each type of neutrophil, lymphocyte, monocyte, basophil, eosinophil. Each type we're going to go ahead and count the absolute values. So we have our we have our total white blood cell count of 5250. So we're going to go ahead and each of these we need to make a percentage. So 67 is 67%, 24%, 4% monocytes, 0% basophils, and 5% eosinophils. So we're going to go ahead and take our 5250, our total white blood cell count, times the percentage of each type, and that will give you the absolute value of each type of cell. So we have 5250 times 0.67 is 3,517, and that is going to be for our neutrophils. And we have 5,250 times 24%, 5,250 times 0.24, which it gives us 1,260 lymphocytes. Okay, total white blood cell count times the percentage, which is 0.04, I'm sorry, 5250 times 0.04 gives us 210 monocytes. No basophils, so we have don't have to multiply that out. And then we have 5% eosinophils, so we have 5250 times 0.05 gives us 262 eosinophils. And those are absolute values of each cell. So I'm going to show you up close. So out of our total white blood cell count, 5250, 3,517 are neutrophils, 1,260 are lymphocytes, 210 are monocytes, and 262 are eosinophils. So we have our absolute values, we have our total white blood cell count, and we have our platelet count as well. And the next part of this video, I will go over the different types and show you pictures of each one, and also pictures that I've taken here during the count on my phone, so you can see that I saw the monocytes, lymphocytes, and the neutrophils. So we'll do that next. Okay, so this part of the video, we're going to go over the different types of white blood cells that you're going to see and what they look like and what they mean when you see an elevation or a decrease. So the first one we have here is a neutrophil. So these have the stained purple nucleus. These can either be segmented or bands. In this case, these are segs here. And this here is a red blood cell, just kind of hanging out in the picture as well. So this is a neutrophil with the purple stained nucleus, and it's the most predominant circulating granulocyte in the blood, and it also is a phagocyte, so it's capable of seeking out, ingesting, killing, and digesting the invading bacteria, microorganisms, anything like that. So if you have a high white blood cell count, you're going to have potentially have an infection or virus going around in your bloodstream. So you would call that a neutrophilia if you have an increase, and a neutropenia if you have a decrease in your neutrophils. Next one is an eosinophil. So we have our nucleus here that stains blue or dark purple, depending on how long you leave the slide in the stain. So we have the red cytoplasm that has some granules in it. The eosinophil is associated with parasitic infection. So not only that, but if we have like a flea bite dermatitis, we're going to see that, allergic gastroenteritis, bronchitis. You're going to see that with a lot of feline atopy. And also if you have heartworm disease, those would be your rule outs if you have a high eosinophil count. So those are going to be your parasitic and majorly inflammatory systemic diseases here that you're going to see an increase in eosinophils, which is an eosinophilia. And they're just, we didn't see too many on our smear today, but we saw a few. And then we have our basophil. Occasionally you're going to see those on a peripheral blood smear, just not that often. It's got the deep blue cytoplasmic granules here that you can see. They're going to be quite the opposite of the eosinophil here. So the inside is staining a lighter color, and then the granules of the basophil are going to be that dark blue or dark purple. Basophilia is really rarely observed. Not exactly sure what causes that. It's an inflammatory process of some sort going on in the body. Typically when you see a basophilia, you're also going to see an eosinophilia. So that might be your atopic dermatitis or your flea bite dermatitis that you might see both, or an extreme allergic reaction. So that is your basophil. Down here is our lymphocytes. So our lymphocyte is the second most prominent circulating agranulocyte in the blood. We've got our large nucleus to cytoplasm ratio, so we have a large dark purple nucleus with a light blue or light purple cytoplasm. And the lymphocytes are going to be your immune cells. Lymphocytosis is going to be occurring in cases of inflammation, lymphocytic leukemia, so cancer, and lymphosarcoma. You're going to have lymphocytosis. You're going to see a lot more of those. So you see lymphocyte predominance. Usually you're going to think lymphoma, especially if you're seeing that in the golden retriever. So think lymphocyte, think lymphoma, or other viral feline leukemia. So the next one is our monocyte, and our monocyte is going to have the inside is the darker purple stained nucleus, and then the outside you're going to have a lighter stained purple with very few granules. It's not very doesn't have very many granules in it. So monocyte is the number one misread cell on a white blood cell differential. So they look a lot like lymphocytes, but they do have this little kidney bean shaped nucleus here. So that's one way you can tell them apart. And then you're going to have your lymphocyte is going to be staining a little bit darker nucleus. So the monocytes are, when you have monocytosis, which is an inflammation or an increase, you're going to see that means indicative of chronic inflammation. So again, our cats and dogs with atopy and things like that, you can either have acute or with chronic inflammation. So those are what those cells are affiliated with. And those are our commonly seen white blood cells and what they mean on a white blood cell differential.